Healthcare in the United States used to take up about 4% of the GDP, so 4% of all goods and services produced in the United States related to healthcare. Well, in 2009, that share of GDP, and of course it's a much bigger GDP in 2009, the share of healthcare has risen to 17%, which is vastly higher than anybody else. Even the second highest is a little over half that. So this is quite a lot of resources spent, and certainly healthcare is better than it was in 1940. People used to go to hospitals to die in 1940, and now some people make it out, and even some people make it out without any infections. But and a lot of that has to do with high-tech services and diagnostics, and these are expensive. But a big share of why healthcare in the United States is so expensive and consumes so many resources is because we are unique among all countries in how we finance it and what incentives we've created for individuals who use healthcare or don't. In particular, since 1940, we've seen the emergence in the United States of third-party payers, and so either government-provided insurance or privately provided insurance pays for health care for individuals. And if you want to liken it to car insurance, the healthcare insurance, the way healthcare insurance works is your auto insurance pays for when you get into accidents and big catastrophic problems. But healthcare insurance pays not only for the catastrophic problems, but also if you need an oil change or a tire changed, or a tune-up, whatever. Healthcare, if it's healthcare, your insurance covers all of that, and so individuals either face no marginal cost of using health insurance, or the marginal cost, even if you have a pretty high copay, as say do I. It's about $20 for anything I want to do. That's still much less than the cost of the services that are provided. And so what we've done is we've taken the cost-benefit criterion out of the picture for healthcare, and there's good reason for that. Healthcare isn't a good like Lexuses or Rolex watches or even computers, where we say, hey, if you can afford them, you can have them, but if you can't afford them, you don't. With healthcare, we're not willing to say, hey, you don't have money, you die. So when we're not going to if we're not going to deny health care to anybody, then it becomes quite a question. How do we ration it? Well, when one has health insurance, that rationing is not effective. There's very little rationing going on, and so we just see very high expenditures on health care, and we indeed see a lot of spending on high cost but low value health services, and this is a huge waste. It's estimated, a number of studies has estimated that a full half of the money that United States citizens spend on health care is wasted. That is to say, of that 17% of GDP, 8.5% of GDP, remember this is a $15-16 trillion economy, we're talking huge money every single year is just wasted because we do such a bad job of this. Well, let's go to the example in the text to put some flesh on our assertion that when we don't allow the cost-benefit criterion to allocate resources, we see tremendous waste. Here we've got figure 13.1 from the Frank Bernanke text, and you notice that they've got a demand curve for health care. This is David staying in the hospital, and so David's going to stay in the hospital as long as the benefit of doing so is greater than the cost of doing so, and let's say it costs $300 a night. Well, I think they supposed he had an appendectomy. Well, that first night you need careful monitoring. It's very painful to move. You need assistance going to the bathroom, etc. The benefits are pretty high, and if David were paying out of pocket, chances are he would definitely stay that first night. Second night, third night, it's nice to get the the care is not as critical. In this hypothetical case, the demand curve is downward sloping, and David would spend one night in the hospital if it were priced at $300. However, let's say David has first dollar coverage. That is to say, every dollar spent on his hospital stay is covered by his insurance. Well, in that case, the price that David faces to stay in a hospital is zero. And then David's going to stay as long as there's any benefit greater than zero. And indeed, in this case, David stays 3 nights in the hospital, not just the one that he would have stayed if he were paying. So, this is a good little picture of why we assert that Americans tend to overuse healthcare services because of the way we finance it. Now, we can use our welfare analysis to count up actually the social cost of doing it this way. Notice that if the marginal cost of a service of one more night in the hospital is $300, and the marginal value function is this demand curve, well, we see that every minute past 1 day of stay, 1 day's stay, cost society more than it benefited David. If we count up that excess of cost over benefit, we get this lost service from an additional stay. And if you add this up over all of David's health decisions through the year, healthcare system involvement through the year, and you multiply that by about 300 million people, 350 million people in the United States, you get a really big number of total surplus that's lost because of the way we do things. So ultimately the size of this loss comes down to a question about the elasticity of demand for healthcare. So I've reproduced this figure with some general notations, but I want to show you why. This is talked through in the text, but it's useful to just think it through with a graph. Let's use a new color. So what if, some people who defend the current system suggest that, Americans don't use hospital and doctor visits frivolously. Who goes to the doctor unless they're sick? It's really unpleasant to go to the doctor. This isn't a big problem. And those people are essentially asserting that there's a very inelastic function for healthcare. And let's just see what this waste would be if I was trying to make it go through that initial point. If the demand for healthcare looks more like D prime than like D, well then that waste from overusage would be this smaller triangle, orange, and not such a big deal. So the elasticity of demand for healthcare is a critical element of determining whether this is a big problem or not. And there haven't been many studies that have tested this question carefully because it's frankly so expensive to do so. But the gold standard is that study by Manning in 1987 that the text cited. And there they had a big group of people, and they randomly assigned them to a control group that had no first dollar coverage, and then the treatment group that had first dollar coverage for health care. And so they watched how families with the different types of health care behaved, and they recorded their health status and also kept careful track of how often they used the healthcare system. And lo and behold, they found that the people that had first dollar coverage used the system a bunch more, I think 200% more. And what's even a worse finding is that health outcomes were no better for that treatment group that had first dollar coverage compared to the control group that didn't. And this is really disturbing because it indicates that the value of the extra services was nil. And indeed, other studies in this area have found that lifestyle choices are far bigger determinants than any treatments you get from the doctor in determining health status. So if you exercise a lot, eat well, avoid drinking in excess, there's 5 or 6 basic lifestyle choices that determine a huge share of any individual's health status. And notice none of those things have anything to do with the healthcare system. So once you're at the healthcare system, you know something's gone wrong, and if you want to pursue health, going to the doctor is probably not the way you would attain good health. So what do you do about it? This is a real problem. We'll talk about a couple things that are going on, but John McCain ran for president on a platform that would have expanded the Healthcare Savings Act that George W. Bush and his administration instituted. It's actually a really neat system. I have a friend who's a benefits manager at Intel. I've been lobbying Pacific for years to offer it to us, but with no luck. But a health savings account allows one to have their employer contribute dollars into this savings account and tax-free, and that money in that account can be used for healthcare expenditures. You would pay just cash for going to the doctor for regular maintenance. You can have a catastrophic healthcare plan, so if you get hit by a truck or get cancer or break an arm, whatever, your insurance covers it. But the key is no first dollar coverage. So I think you have to have $1,000 or even a higher level of deductible, but your employer can pay into that account. Just to give you an example, Pacific University pays for my family coverage pays almost $1,000 a month, so maybe more. I know I pay a good chunk of that. So total healthcare payments are on the order of $1,700 a month for me and my family. Anyway, if you put that money aside, you have a big wad of change in the years where you're well, and that's there to pay for healthcare coverage. And if you pay it out, you lose it. It's your money. Anyway, that I find personally that kind of a reform was much more appealing than what we have, which is the Affordable Care Act, which itself is better than what existed before that. But I was a big fan of John McCain's plan. But anyway, one thing that's gone on is the move toward health management organizations. And here, people that sign up, I'm a member of Kaiser. I go to Kaiser. My doctors are paid the same whether they send me for tests or treatments or not. And so they don't have an incentive to send me for extra x-rays and put me on extra meds because they get a kickback. As, believe it or not, most doctors outside of an HMO structure do, or the hospital does if you're not an HMO. So the move toward HMOs slowed down the rise in healthcare costs, in particular during the early 90s, but not after that. There is a problem with the United States in our reliance on, even all the Affordable Care Act did was to expand our reliance on private health coverage to more people in the economy. The problem with relying on private insurance is that private insurance companies want to make money and profits. That's what companies do, and you make more profits by not insuring sick people. And that how do we get around that? It's been pretty tough. The Affordable Care Act, or otherwise known as Obamacare, that kicked in this year. Actually, we're living through this experiment. And just to recap, I've got a video that actually is a really neat run through the Affordable Care Act. But ACA requires that everybody buy insurance. That's the individual mandate. Requires that insurance companies cover everybody, and then it offers a subsidy to low-income people. And we've actually seen healthcare premiums fall, and no surprise there, right? You're bringing more healthy people in, and yeah, healthy people in insurance, healthy people paying insurance premiums. We're paying for the sick people, and that's the way insurance works, whether it's private provided or government provided.